Women's Health Explained by a Lady Doctor. Hi, everyone. Welcome back to our channel, where medical topics are made easy. Today we will be talking about women's health, explained by a lady doctor. But before we start, make sure to subscribe to our channel to get notified when we upload new videos. Now let me introduce my guest for today. She is a gynecologist, an infertility specialist. We will be having an open conversation about women's health, covering various topics that are important for women of all ages. Let's get started. Starting off with reproductive health. Dr. Raki says, it is crucial to understand and educate girls about their reproductive health from a young age. Open communication with parents, teachers, and healthcare providers can help break the silence surrounding menstruation and sexual education. When it comes to fertility and family planning, Dr. Becky emphasizes the importance of knowledge as power. She says, many misconceptions and myths surround fertility and family planning, which can lead to stress and anxiety for women. By understanding how the body works and the available options for contraception, women can make informed decisions about their reproductive health without feeling overwhelmed or judged. Both doctors agree that access to reliable information and healthcare services is essential for women to take control of their reproductive health. They encourage women to prioritize their health by scheduling regular checkups, screenings, and open discussions with their healthcare providers. Dr. B. Raki adds, it is vital to remember that every woman's journey is unique, and there is no one-size-fits-all approach to reproductive health. By fostering a supportive environment, breaking down stigmas, and empowering women with knowledge, we can ensure that every woman feels comfortable and confident in managing her own reproductive health. Moving on to hormonal health, Dr. Rebecca highlights the significant impact hormones have on a woman's body, explaining how even slight imbalances can affect multiple systems. Hormones are chemical messengers that control how cells and organs do their work in your body. Being a gynecologist, she deals with hormonal imbalance issues every day in her clinic. Most common hormonal disorders in females include polycystic ovarian syndrome, thyroid disorders, and problems related to menopause. However, many other conditions can also lead to hormonal imbalance, such as stress, poor diet, and lack of physical activity. The good news is that hormonal imbalance can often be prevented or treated by making lifestyle changes, such as eating a healthy diet, exercising regularly, and managing stress. In addition, there are also medications and therapies available to help manage hormonal imbalance symptoms. With proper diagnosis and treatment, women experiencing hormonal imbalance can live healthy and fulfilling lives. As the conversation progresses, Dr. Rachel addresses the significance of early detection and preventive measures in managing women's health issues. She emphasizes that certain conditions, like cervical cancer, can be life-threatening if not addressed promptly. She explains that regular screenings, such as pap smears and HPV tests, can help detect precancerous cells, allowing for timely intervention and prevention of cervical cancer. Additionally, Dr. Rachel highlights the importance of vaccinations, particularly the HPV vaccine, which can protect against the virus that causes most cervical cancers. By raising awareness about these preventive measures and encouraging women to prioritize their health, Dr. Rachel hopes to empower them to take control of their well-being and prevent potentially life-threatening conditions. Dr. Becky shares her experience treating numerous women with endometriosis and adenomyosis. She says, endometriosis and adenomyosis are two separate conditions that occur in women who have a uterus. Endometriosis occurs when tissue, similar to the uterine lining, grows outside of the uterus, while adenomyosis occurs when this tissue grows into the muscular walls of the uterus. Both conditions can cause pelvic pain, pain with intercourse, and pain with menstruation. The pain associated with these conditions can be severe and debilitating, and it can have a significant impact on a woman's quality of life. It can also cause infertility in some cases. Fortunately, there are treatments available to help alleviate the symptoms of endometriosis and adenomyosis. These treatments may include pain medications, hormonal therapy, or in some cases, surgery. Next, the doctors discuss the importance of women prioritizing their own health and well-being. Often women are caregivers for family members and tend to put their own needs aside. Dr. Rebecca emphasizes that self-care is not selfish, but necessary for women to be able to care for others effectively. She encourages women to make time for their health, whether it's through exercise, relaxation techniques, or regular checkups. By prioritizing their own well-being, women can be better equipped to handle the demands of their daily lives and provide care for their loved ones without burning out. As the conversation continues, Dr. Rebecca shares her personal journey of becoming a doctor and the challenges she faced as a woman in a male-dominated field. Her passion for women's health and dedication to her patients shine through as she discusses the importance of representation and mentorship for young women interested in pursuing medicine. She also touches upon the gender pay gap and workplace discrimination, urging for greater equality and recognition of women's contributions. Dr. Rebecca's story is one of resilience, determination, and a lifelong commitment to advocating for women's rights and health. The discussion then shifts to the impact of societal expectations and gender roles on women's health. Dr. Rebecca acknowledges the pressures women face in balancing work, family, and personal life, and how these expectations can contribute to stress and burnout. She emphasizes the need for support systems and policies that help women navigate these challenges, while also maintaining their physical and mental well-being. The conversation also touches upon the importance of body positivity and challenging unrealistic beauty standards set by society. Both doctors agree that women should feel comfortable and confident in their own bodies, regardless of societal pressures. As the podcast draws to a close, Dr. Rebecca leaves listeners with words of encouragement and empowerment. She reminds women of their strength, resilience, and ability to overcome challenges. She encourages them to prioritize their health, follow their dreams, and continue breaking barriers. Dr. Rebecca's inspiring message resonates with women everywhere, leaving them feeling motivated and ready to take on the world. Throughout the entire conversation, both doctors use simple language, avoiding technical jargon to ensure that their audience fully understands the importance of each topic. They provide practical tips and advice, empowering women to take charge of their health and make informed decisions. The podcast serves as a valuable resource, equipping women with the knowledge they need to navigate their own bodies and advocate for their well-being. Thank you for tuning in to this episode of our channel. We hope you found this conversation between the two lady doctors insightful and empowering. If you enjoyed this podcast, don't forget to subscribe to our channel and leave a comment below with your thoughts and questions. We value your feedback and are committed to bringing you more informative and engaging content in the future. Until next time, stay healthy and take care.